Welcome to the latest edition of Health Matters. I'm Rosanna O'Connor, Public Health England's National Director for Alcohol, Drugs and Tobacco, and we're here today to talk about preventing deaths from drug misuse. The number of people dying from drug misuse in England is rising, and in each of the last 3 years levels have been at the highest recorded, and heroin-related deaths in England and Wales have doubled since 2012. This discussion will cover the main drivers behind this disturbing trend and consider how local commissioners and service providers can ensure the capacity and quality of drug treatment services are maintained. And we also want to think about how people can help each other and how drug users' access to wider healthcare is improved in order to prevent further increases in drug misuse deaths. I'm really pleased today to welcome a panel who can talk about this most important of subjects with great expertise. Paul Lennon, hi Paul, is the founder and director of Aurora, a peer support project in Lambeth, South London. Rachel Hope works as a community safety specialist on drugs for Newcastle City Council. And Prun Bijal is a consultant psychiatrist and medical director for Change, Grow, Live, a third sector organisation that provides substance misuse services across the country. Okay, Prun, if I could start with you. CGL have experience of working with drug users across the country, and you sat on PHE's supported inquiry into recent rises in deaths. What do you think is behind the recent increase in deaths?
Thanks, Rosanna. Well, what the quite comprehensive inquiry told us is that people who are dying from drugs such as heroin often are dying outside of treatment, and that's a very important factor to take note of. But what we also found is that there are associated factors such as geographical variation. So if you live in an area with higher levels of deprivation, that is also associated with increased levels of drug-related deaths, as well as physical health conditions associated, such as respiratory conditions, liver conditions, and such like. So those are really important factors which we found. What we also found is that other related morbidities, such as mental health conditions and suicide, are overrepresented in our client population. So those are important factors to note.
Okay, thank you. Now, Rachel, you commission drug treatment services in Newcastle, in fact, where drug-related deaths are especially high. And you've worked very closely with the services that Prun refers to, especially the NHS. What can commissioners in local authorities and the NHS do better to understand deaths in their areas and how to prevent them?
I think the first thing, Rosanna, is to understand that although some of the overdose numbers look quite low, actually they're indicative of other factors that are issues across the system. So, for example, issues with poor health, as Prun said, in terms of cardiovascular, respiratory failure, indicative of issues in terms of treatment effectiveness or engagement with treatment. So I guess what I would say to commissioners is that what we need to do is make sure that we monitor all of the data sources that are possible in local areas, including harm reduction, needle exchange. We need to make sure that what we are also looking at is profiles that are happening nationally as well. I think what we need to do is to build up effective drug-related death reviews locally to try and understand what some of those other health conditions are, and then look to joint commission or make sure that we've got outreach, in-reach services available for the cohort as well.
Yeah. Okay, thank you for those points. And Paul, you were a founder member of a peer support group in Brixton in South London. What do you think that current and former drug users can do to better support people and possibly save lives?
I believe the peers have a real ability to be able to give information and advice to current drug users, and I think in particular with overdose and naloxone training. Naloxone is a medication that reverses the effects of a heroin overdose, and I think that's a real part that peers can play within the treatment services in the local community.
Okay, thanks for that. And Pran, you made the point, I think, when you first spoke, because we know a lot of people who are dying aren't actually in treatment services and haven't been in treatment before. So what can drug treatment services do to get more people into treatment, and what else can they do to protect people when they are in?
So some of the factors when people are in treatment I've already identified, such as naloxone, absolutely very effective intervention, life-saving intervention, but also making sure that we've got the basics right, so basic harm reduction like needle exchange, optimised opiate replacement therapy when people are in treatment are really, really crucial. But fundamentally, I think we need to make sure that the bar is not set too high for people to access treatment. It should be something that's attractive, something that they view as could be helpful to them, and that actually is going to meet their needs. The people don't recover if they suffer from harm, whereas if we can get them into treatment at an early stage and then give them the opportunity to recover when they're ready, that would be a very positive thing.
Right. Okay, thank you for that. And Rachel, we've been talking, I think, and hearing a lot about the majority of deaths being related to heroin use, but that doesn't paint a complete picture of who is dying. And I understand, for example, there's a particular issue for women and their vulnerabilities. Can you talk a bit about that and about the other causes of death?
Female drug-related deaths has been rising year on year, unlike males, which had a peak and a bit of a drop. And what we find with some of the female deaths, particularly in the northeast, is that actually there is a lot of polyuse there. So there's prescribed medication, heroin, alcohol, benzodiazepines on top. So it's essential that we work with NHS, GPs, for example, to understand the sort of OST being prescribed alongside other opiate derivatives. But what we're finding with some of the female deaths, certainly in the northeast, is that actually the links with trauma as young people with being parents who've had children removed is very, very painful for them. So how do we deal with sort of that family issue? And actually a lot of the females may have come from the looked after care system themselves, so it seems that there may be a generation that's repeating itself. So working with females in that context is so important, particularly those who've had experience of trauma, sexualised exploitation as well.
Okay, thank you for that. Pran, I understand amongst this group of people who have particular physical health problems, lung disease is a real issue. Could you just tell us a little bit more about what you're engaged with to address that?
Well, absolutely. There are a range of physical health issues, but COPD, chronic obstructive pulmonary disorder, is also a significant issue due to high rates of smoking within our client population. So as an organisation, we've followed the innovative work and groundbreaking work of the Aurora project, looking at providing co-located COPD services within our regular substance misuse treatment services, to make sure people who access our services actually get that screening and get the appropriate help.
And that is an initiative, presumably, that could be taken up anywhere.
Absolutely, and is a great example of partnership working where services that are already commissioned to deliver community respiratory health can come where their actual the need is, which is often in our services and in mental health services.
Okay, thank you. From the point of view of people who use drugs and drug services, what are the key messages we should take away from this?
Well, I think the key message for me is that treatment works. Treatment has the potential to reduce harm and also promote recovery. I think another message to get across really is that I believe that disinvestment in the services will lead to more drug-related deaths and more harm. So I'd certainly like to promote continued investment within the treatment services.
Okay. Thank you for that. So thank you all. So, but maybe to summarise, I think this is an issue that affects us all, and that it should be a concern for local leaders and for commissioners. And I think you've emphasised, and you did particularly, Paul, the need to maintain investment in these services. And we heard how important it is for treatment providers and for general healthcare services to work together, and the importance of that service users can play in providing support to each other, and in particular the efforts that should be made to distribute naloxone to all places in the system that could make use of it. And I think it's important that we listen to and engage with service users, particularly I think your point, Prun, about needing to reach out and engage people who aren't currently in treatment, because we know that the majority of people who are dying of drug-related deaths actually are dying outside treatment. So please take a look at the Health Matters online resource. It includes case studies, downloadable infographics and slides that you can use in presentations and in discussion with colleagues. And thank you for watching.